Ladies and gentlemen of the audience, so artificial intelligence, hype versus real value. We all know about AI. We all know that AI is shaping healthcare globally, from diagnostics to drug recovery to patient management and hospital operations. Yet in our context, the South African and African context, conversation normally moves between high expectation and the practical realities we find ourselves in. With our experts on the panel today, we are going to explore some of these nuances, some of these realities we find ourselves in, and also consider how can we practically move from hype into African reality. All right, my esteemed panel members, I think let's start off with something which is akin to the reality check that we had just mentioned. I'm going to invite two of you to answer this. Where is artificial intelligence currently delivering measurable value in African healthcare? And where is it still overpromised? This is a difficult one, but I would explore maybe even geographies and or areas so far as health domains are concerned. Who would like to take that?
It depends on when you talk about the healthcare spectrum, right? Because let's take a step back and think about how people are going to consume it. We're talking very much at a consumer level, us as patients going to a doctor or seeking medical assistance, right? But if you think about it in other sectors like banking and telco and media, the AI is built into the platform that you consume. So it's invisible to you as a consumer. So, for example, one of the big cases where in healthcare that AI is being used is around TB diagnosis. That the AI is built into the X-ray machine. So it's very likely that us as patients are already consuming AI, but it's completely invisible to us because it's just easier to do that, right? So, for example, you go to Netflix and it's sending you a list of recommendations. There's an AI engine in the back end that has learned what you like and is trying to suggest more to you. Same with social media, Amazon, etc. So there's that notion of the invisible AI. And then there's the visible AI, where we would go to sort of like a chat GPT type service and say, listen, I've got a headache and this and this and this. And if you go to WebMD, it's always cancer and you're going to die. So maybe that's not such a great thing to use, but we still have to get to that point because the confidence level that I've seen is not there yet. We're still kind of looking at use cases that are not trivial, that can unlock business value. So.
Hi everyone. I completely agree with that. There's a lot of times where we don't necessarily know that there's AI. But I'd also like to take a step back and talk to you about the hype and AI. So obviously in South Africa we know that we have systemic challenges, right? We have workforce shortages, we have data fragmentation, we have very uneven healthcare. So where we distinguish between the hype and what AI can do is really, sorry about that, guys. It's really just looking at how we can make this practical for doctors. As soon as you start thinking that AI will be the end all and beginning all of these systemic challenges in South Africa, that's where we really see a problem with in terms of hype. So when it gets to really helping clinicians to make better decisions, to improve diagnostic errors, that's where the value lies in South Africa currently, and that's where we are. So my esteemed colleague mentioned that obviously there is TB X-rays or AI machines in AI machines in X-rays for TB. But another really useful value or business case is if you go to some dermatologists, they have AI in smartphones, they have literal models in smartphones, obviously using IoT devices, to help you detect skin lesions. So I do think we are at a phase where we are starting to workshop like Medcare, like Dr. Richard mentioned, where we can look at patient care and where we can look at how we can help our doctors, but there are some advanced use cases that has already come to life.
Because I'm actually in a company that primarily, almost exclusively services the public health. So we're in the public health side. And I actually think we aren't hyping this up enough.
the potential for AI to make up for those workforce losses is just not hitting the ground. And so I think to counter some of the narrative, I think we just aren't leveraging the capabilities sufficiently. And one of the places is adoption at scale. We have shown through multiple pilots, and we have created all these cool models that end up sitting on a shelf and does not actually reach the benefit of the patients, especially in public health. So it's not a limitation of the technology, it's not a limitation of the data quality, it is something else. And I won't even talk about political will and some of the dysfunction within our public health system, but I think that we probably aren't doing our patients enough of an honor, because we are kind of sitting on real potential to help them and not leveraging it.
Good people of the audience, definitely a lot of insights. I love the fact that when we're talking about evangelizing the concept of AI, there's a positive sentimentality about it, because indeed, there's a lot of benefit that can be derived from a commodity like AI. Thank you, Sam. Thank you, Lucian. Thank you, Zia. I want to zone in into something that you believe was controversial, good Lucian. And for good sake, what do you believe would be the barriers for the proper adoption within our African reality, AI-wise? You all three are welcome to answer.
So this is a very interesting question. And most of you heard the story with Netcare. So Decision Inc., the company that I work for, was the developers of the Netcare app. As well, when Quinton was talking about the mining, we actually developed the Exoru app with translation services, but I'm happy to talk to you about that. One of the key things when we are doing development in this is really embedding governance and equality and security in your design phase, not after development. And I think one of the biggest blockers in the African context is a lot of the models that we use, and I'm not talking about if you go actually and build your own model, but if you are using the models that are available to us, it's black box models. Meaning, one, we don't know how it's trained, and two, the chances of it being trained on actual African or on African data sets is obviously a lot less, meaning there's a big chance of poor misjudgment or not understanding the diagnosis or error in diagnosis. So there's quite a lot that you need to take into account when it comes to how these models are designed or the data sets that they are trained on, and I think that's one of the biggest blockers. There are obviously ways that you can counter it, and one of the things is retraining and contextualizing your models. What we did at Netcare is we actually fed it additional data to give it the unbiased opinion, and obviously helping to get the model to retrain on non-Africans and Africans, which makes it more accurate. But I think that's one of the biggest blockers. Yeah, that's my 2 cents.
I actually think it's probably a misunderstanding of the technology and where its kind of benefits are going to be derived from. There are many folks who will still perceive it as a threat, and they're coming after my jobs, and we're going to depersonalize medicine, and I think that's all wrong. In fact, the AI is going to take away quite a lot of that busy work and actually give our healthcare workers the time to personally connect with our patients. That's kind of the magic of what we're talking about here. I had a fascinating conversation with a healthcare worker who was trying to understand what we were doing, and they sincerely said, "Do you install the robots in our facilities?" And I was like, that is kind of like our job to educate and create awareness so that it's not perceived as this threat that's been taken over our job. So I think that's on the political side as well as on the delivery, and that's probably where we should be focusing in the short term.
I've got a couple of perspectives on that. Some very controversial, and some like, let's try to phrase it this way. There's innovation in the box, and what we're talking about today is very much innovating in the box. And there's innovation outside of the box, and we'll talk about that aside. So here we are, all healthcare professionals in the medical fraternity, insurance companies or practitioners, or in the current healthcare system as we know it, looking for opportunities to innovate, be more efficient, improve profitability, better reach, quality, service, blah, blah, blah. All those dimensions, right? Why do we need this? why does the medical insurance industry as it exists today need to exist? Because if you think outside of the box, who has the most data around the individuals who actually use their products? Because we all just said data is the lifeblood, oil, blah, 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 right? Wonderful. Who has the most data about every one of us as individuals? Tech companies. How many of you own an Apple Watch? How many of you are using Android watches or another brand or Garmin? Right? This thing is tracking all your vitals all day, every day. The new versions can check your health, your blood pressure. It can tell you about your cycles. It can tell you about all sorts of things that your GP has no idea of. Your medical aid provider has no idea of. So why doesn't Apple start a medical insurance company and offer it to you as a service with your iCloud subscription? They did it with payments, but Apple Pay everywhere. They got it with news. We're using Apple for all of our storage, our data. You've turned on Siri and Apple Intelligence. You trust them probably more than you do your own health provider or the government. So when you start thinking about outside the box, and if you look at how this industry can be disrupted, solutions point. We are not innovating hard and fast enough. When we speak to financial services organizations that are typically legacy organizations, right? And we say, how do we make economists more efficient? And the question is, why do you need an economist? Because what are they doing? Fancy Google searches, gathering information, looking at a bunch of data science sources and producing a report. Hello, ChatGPT can do for that 5 minutes. Why do I need an economist? So the disruptive potential is there. I think the imagination to really innovate and really push the boundary of what's possible is what's kind of lacking a little bit. All of the other challenges are technology challenges, and we will get there. NVIDIA just launched their DGX box last week. It's basically an AI desktop supercomputer. You don't even need to go to the cloud anymore. You can build AI on your desktop. It's $10,000. It's not the cheapest thing. That's like 100,000 rand, right? It's not the end of the world expensive. So imagine if you had to go to every single one of your hospitals and build an AI cloud in that clinic, using medical data in that area, hyper-personalize and customize it for that specific environment, for that community, for that street. What would that mean for healthcare? How could you change the way that you think about this cross-subsidization thing, which is a nonsense model, really, right? I go to gym every day. Why must I subsidize a fatty? He made bad choices. He must deal with it, right? And that's the only way you get people to change their behavior. So I think if we really think about it, we're not hyping it up enough. We're not pushing the boundary enough. And we're still thinking in the box about, can we just make the same process faster? And frankly, that's not what AI is going to do.
I love the fact that we even considered the whole concept of the origination of what drives the artificial intelligence algorithms. There's this notion of the global north and global south. We all know about the east and western civilizations, hemispheres, etc. But on an assessment, it was determined that 91% of data actually comes from the global north. And that is what has been trained or used to train AI models. Of course, there are exceptions, but we're talking about the primary globalized AI models. And that's telling in the sense of the origination of the opinionation. That's telling with respect to the bias. That's telling with respect to the environmental circumstances contributing to medical conditions, etc., etc. So there are a lot of variables of consideration. I love the fact that we also moved into the concept and the true nature of innovation. What is the true nature of innovation? Is it just adopting the next biggest trend, or is it really sitting down as a nation, as a collective, heck, even as a business, as an individual, and questioning the status quo and looking past our own limited consciousness? I think we're moving in the right direction, but we're moving with a pace that might not necessarily match. Recall earlier we mentioned medical and the medicinal fraternity has a bit of a legacy view around slow adoption, slow change. Change management is always a concern with our fraternity. And yet on the technological side, rapid evolution. There's even frameworks for rapid evolution and rapid adoption. So there's a reality check between hybridizing both. And I'm glad that our speakers touched on all of that. So let's move on to the next concept. What would be causing this sort of landscape that we find ourselves in, this geopolitical situation of a 90-10 split, this reality that we're not innovating fast enough? What do you, esteemed panel members, think about the state of education, knowledge that we have within our African continent with respect to the adoption of AI and other advanced tools, and how can we ensure that we change the game, we ensure that we progress the status quo? Over to you.
So I think you touched on this a little bit, but one thing that I really liked you were saying was, a lot of folks are just thinking about this as an efficiency play, and absolutely there will be massive gains in efficiency. But if that's where we stop, we've absolutely missed the point here. It is about unlocking new capabilities that our creativity is kind of limiting us by, and so it's in order to break the mold, so to speak. And I'll talk about a very tangible example. We build these machine learning models in Nigeria to anticipate basically patients dropping out of care and what to do about that. And when we originally put these very sophisticated predictive analytics that can anticipate when Lucian's going to drop out of care, they just repeated the same age-old interventions, tracking and tracing. And again, they're missing the point about what you can now do. What does this unlock while you have the patient sitting in front of you to prevent them from dropping out of care? And so that's just a simple example of, not being limited by how we've done things in the past, and actually creating that awareness that there's new opportunity, new interventions, new ways to personalize the care because of AI and because of these new capabilities that we are unlocking. And again, it's just not just about efficiency and reducing headcount.
Yeah, so this is interesting when you talk about awareness and education, right? So I think South Africa is a very interesting country in that we often say one thing and we do something else. We're quite contradictory. We live as walking paradoxes in some way. Because on one hand, we talk about education is important, we need to educate, we need to go and do all of these things. How many new schools have we built? How have we modernized our science and maths and learning curriculum? Because you don't just produce engineers and doctors out of thin air, right? There's a 12-year schooling process that you've got to go through. How much of the investment that we make in education actually makes it to grassroots, to develop people? For all of us sitting in the room here, who's the next generation coming in behind you? So, there's all of these things, it's multi-layered, it's quite complex, and we don't want to go down the whole political route, but if you think about the economies that are successful and that are going to own the world, as you said, 99% of the AI models are out of the US. They actively attract talent. They've got the H-1B Genius visa. They go around the world attracting people. South Africans have moved there. Why couldn't we create that environment here? Where's our own Silicon Valley? Because we're always looking for talent and skills. So what have we done about it? Why is it always someone else's problem to solve that we will consume but not produce? We used to be a fantastic production country a long time ago. Arms and defense, security, companies like nanotech, banking systems still run on them. What happened? Did we forget how to innovate and we just became consumers? Because if you're a consumer, you're at the mercy of everybody else. If Facebook or ChatGPT or whichever tech platform says, South Africa's embargoed, you're not allowed to use our technology. Like how IBM pulled out of banking in the 80s, right? What do you do then? We're fortunate that we live in a very resource-scarce country because that forces innovation and creativity. So if we want to build this utopic future and we want to build all the right things we want, we've got to stop waiting for other people to do it and start doing it ourselves. We've got to go to a local school and say, how do I take those 5 kids that are super bright and we're going to put them through university? Not we're going to come paint the school and take a couple of cool pictures for LinkedIn and say, corporate social responsibility, tick the box. So that's what a lot of it's come down to, right? If we're serious about something, you put your money behind it, otherwise it's not helpful. So I think there's a couple of things that we've got to fix structurally. But in terms of the skills and the challenge, you're also going to have to create the pool in industry where there's a place to go. Because if you talk to young people today, they've got answers to problems. They've lived it, they've experienced it. How would you start a medtech business in South Africa? Where would you get funding? You know, you've got to go to the bank and the bank will tell you no. You ask corporates say we don't invest in that sort of stuff. So then what happens? You inevitably go somewhere else. Right? You go to India or you go to the US. So unless we create this ecosystem where you, one, build talent and then give them direction of where they can actually go in and start delivering that capability, that talent. Even if it fails, it doesn't matter. You know, you never get anything right the first time. So how do we treat that actively? And that takes time. But if we don't want to be the digital losers in this AI race, we need to start like last decade ago.
So I completely agree with the ecosystem comment, 100%. But I think there's so much more than just getting AI ready. I think for us to really get to the level that you exactly said we should be and hyping up, and I think everyone in the room agrees, we need to get to that. It's so much more than just building and getting there. It's really, you kind of need three fundamentals. You need AI readiness or data readiness. And in most cases, especially in our public health systems, we don't have that. Then we need infrastructure, which costs money. And then we need human trust. So especially talking about the knowledge and talking about how people should, the human trust really falls back into AI literacy. And when you talk to a nurse that's been doing this for 50 years, and it's exactly like you said, so scared because what if this takes a job? I think really that's the three fundamentals we need to get to that, to get to the hype and to get it to adoption. There's so many other things that we can do, but there's a lot that we need to do to change systematically to get to that point. But I completely agree, more awareness and more forums and more environments or ecosystems to do this is exactly where we should be starting.
Ladies and gents of the audience, identification, adoption, nurturing, ensuring that we create the ecosystem, but also considering our current reality versus our aspiration. I love that we went from what our future state is to our reality of our current state and the chartering of how we get there. So brilliantly done, good panelists. And I would also like us to, as much as we've caucused and we've spoken, and 70 to 80% might have been aspirations and negative, there are positives to look at, of course. Perhaps to inspire our audience as well, my question would be, what will meaningful AI-driven healthcare look like in Africa for the future? And if you must touch on a few points about how we get there as well, that's great. But how do you envisage, as leaders within the industry, that the future of AI-enabled Africa healthcare will look like?
So whenever I think about the future and what it should look like, and it's quite easy for me. It's not to replace, it's not anything like that. It's really to enhance our care. How do we care better? How do we amplify human capacity? So to me, it's really, really an easy thing. AI will always be a million times. I mean, we are talking about supercomputers and the next step and the next step. It is not to replace doctors. It is not to, yes, it is to disrupt, but it's to disrupt so that we can care better. So it's quite an easy thing for me when we look to the future and what it should be, especially in South African context. It's to have more equal care, to have doctors that are paid well, that can use technology. It's not specific use cases, but it's really taking the socioeconomic factors that we have and bringing it into life and thinking, how can we care better for every single South African?
Yeah, I think we need to find the Candy Crush of AI. I absolutely loved how getting nurses to use tablets the entry point for them was Candy Crush. And we need to find what that is for AI, for most folks. And I honestly don't think it's that hard. I don't know if you guys remember when you experienced ChatGPT for the first time, that magic, that emotion. We are delivering those types of large language models through our tools, and our healthcare workers are experiencing the magic of AI for the first time in their healthcare app, which normally they hate their healthcare tools. It's there to audit them, it's there to check up on them. But if they can experience that magic through a healthcare tool, I think that really sparks quite a lot of joy. One of the things we are, invested in and breaks our heart is just how overwhelmed and depressed our frontline healthcare workers are. And so for us to be able to build tools that give them confidence to take on bigger problems and get them out of the data analysis and the administrative tasks and really get them back to what they're passionate about, which is kind of like dealing with the patient in front of them on a human level, that is really what excites us and what's driving so much of our innovation.
And there's this whole concept of inside-out innovation, right? Because every one of your companies hires really smart people. You really smart people sitting here. Probably tons of ideas already floating around. How do you channel that internally as an innovation funnel and create a safe zone for people to try things? Because coming to the concept of not waiting for other people. So from a Deloitte perspective, quick story, we have a platform called Gigs. And Deloitte Gigs is a way that you come up with some sort of like a hackathon type concept, and then the firm sponsors, and you get a whole bunch of people together, and they work out this project. And one of the projects that somebody worked on was very personal to them. Somebody in their family was going through, was diagnosed with cancer, and they needed to go for radiotherapy or whatever it is on the lung. And it was actually quite a process. You got to get to the doctor's office like 3 hours early. They mark you up with the markers. Imagine you're already standing there in a freezing doctor's surgery, topless, not having a good time. They're marking you up because they've got to pinpoint that radio beam exactly where the tumor is, or you'll destroy healthy flesh, right? So they went through this whole process, and each time it cost thousands of rands. So what they did was, they came up with this idea of how about taking all of the scan data from the person, uploading it into a service, an ML service. The machine language service used a bit of AI and automatically calculated exactly where the beam needed to be based on 3D MRI scan, and then sent that back to the machine. The scans take 15 minutes now, and from thousands of rands, it costs less than $5. So that's the kind of innovation that somebody saw from a personal perspective and created the service to do it. And luckily there was a platform to fund it and bring the people together. Right? Those sort of micro innovations, you can call it that, when you put them all together, it makes a massive step change. You can radically change the face of healthcare with micro innovations. You don't need a massive kind of one leap thing. Because all of those little things make a difference in the care of an individual's life. Instead of 3 hours in a humility experience, 15 minutes you're in and out, and you're done. Suddenly a doctor is focusing on not marking up, they're focusing on healthcare and advising and wellness and all the things we talk about. So I think if we create those platforms, the innovation is there, the ideas are there. How do you funnel them so that they become reality?
Ladies and gentlemen of the audience, this is wonderful, and I want to pull a common thread. The human condition is synonymous with the future. Ensuring that we use, we adopt, we evolve, we ensure that we recognize and we nurture talent to ensure that that recognized talent is given an opportunity to mature to a point where true innovation blossoms. Pretty amazing insights, and definitely something that resonates with all of us. Given the different demographics, given the different generations which are sitting around the table, we all have a part to play. We all have innovative contributions, and we all have a duty to drive into the future in a way that is socio-economically responsible, but also in a way that celebrates the human condition. Thank you, good panel members. Thank you, good audience. Before we leave, any questions from the audience for our panel members?
I think mine, I don't know if I should put it as a comment or more of a question for maybe your overview. One of the panelists actually mentioned about the gross divide between South Africa as a whole. You have Cape Town, which has some of the most brilliant things, like the most innovative things, and then you come to deep rural Northwest, where no one really knows what a phone is. They just know these are brick phones. So, and the other aspect that we're looking at is the fact that for you to have known about, like most of the people here, for you to have known about something called AI, it's the fact that you heard something about it. Otherwise, this room would be full. If a lot of people are exposed to these things. So, and the beauty about AI is the growth. I think it's an exponential growth in terms of what we can do with AI, but we're still leaving the bulk of the people, probably around 80% of the population of South Africa is left behind. So how do you go back to the basics in terms of, I'm sure it's going to be a very broad question, from teaching a child how to operate AI, let alone, remember you have to be computer literate to some extent to be able to use AI. That's what I'm saying. I'm not sure if it's more of a comment, but it's just something maybe worth noting to say. In as much as we're so far in terms of AI and how far we are, but if you look at the South African context, 80–90% of our people know nothing about technology. Some don't even know there's such a thing as WhatsApp, let alone when already WhatsApp has integrated AI in its program. Yeah, thanks.
As usual, I have an opinion on this. So, we've got to be careful because on one hand, I can see how corporate South Africa can really help because we've got the skills, the capabilities, the technology, etc. But on the other hand, we should not be taking over what government is supposed to be doing. Right? The public service is there to provide that education and bring people and be relevant and those sort of things. So maybe without getting all political and complex and rabbit holing here, on one hand, we've got to hold government accountable, right? That's the one thing. The second thing is, more realistically, we also got to look at how do we create a different kind of outcome for those children, right? How do we go in and have a intervention or expose them, bus those kids from wherever to our places of work, right? Come and see how we do it. Look at what this working world looks like. Expose them to the technology, like a school excursion, right? And maybe in some way that will spark something in those children for them to want to learn, or at least have some affiliation with the brand and create a different outcome. It's a very complex answer. We could spend the whole conference talking about that. But we've just got to find ways, I suppose, in our own communities to go back, even as individuals, to do something to expose children, to show them stuff, and say, here, look at this tablet. Have you seen this thing? Have you played Candy Crush? And maybe that will create enough of a grassroots wellspring in terms of interest in technology as well.
I think I'm a little bit more optimistic on this one, and I'm going to speak from an African perspective, because again, a lot of our work's in Nigeria and other African countries, and the absolutely amazing thing is how quickly people can get on board with these technologies if the products are well designed and fit for purpose. What we cannot do is take things from the global north and just kind of plug and play into our African context. That will fail. However, if we think deeply about what the specific needs are, simple things like connectivity, which we've come a long way for, but our principle has always been offline first. Create something that can run offline, and when you go and connect, it will sync and do the rest of it. We will get there. And even large language models today can be using nano experiences on a mobile device that does not need to be connected. So I think that there is a lot of opportunity for our African context if we are just thoughtful around designing and kind of building things that are fit for purpose.
It's a really good point, Lucian, and I want to thank you for that question, because this is something that we have to struggle with every day. So I don't think any of us has an answer on how we can, I wish we could, but we don't necessarily have the answer. But I do want to slot in with what Lucian said in terms of design. I'm going to use the Netcare example again because it's so important to understand exactly that. It's so important to understand the equality and the biasness, and then also understand that not everyone has the same privileges or doesn't not always have or grown up with this technology. So what we did at Netcare is we went through an entire assessment and we basically said, okay, so most of us don't have doctor's degrees, so we won't understand what the doctor says about our medical records. But let's, for instance, go to a 4th grade reading level. So building it in a way so that people to a grade 4 reading level can understand it. And that's the type of things that you need to add into principle when designing AI solutions. So you might not be able to get everyone upskilled and knowledgeable on it, but designing it in a way so that it's easy accessible, easy to use, and to catch up as quickly as possible is something that we can do. I hope that answers your question.
Thank you for the question. Good, sir. Good audience members, we have one more question. Yeah.
All right, thank you. Mine is from the patient's perspective. I had the panel members talking about education, and it's very important, it's true. And we're talking about education of the service providers, now the healthcare workers. But then from the patient as perspective, do you think there's a need for the public to also kind of be AI literacy that can be allowed to use that? And do you also think that we've seen with the COVID vaccination, there was a lot of anti-vaccination energy that we put, yeah. So, but then, can we also maybe expect something with AI? Because, I mean, we're going to have robots moving medications in between beds and stuff. So, do you think it's something that you might also just put in mind that you might have what is it? Anti, like some kind of where people they will just oppose that and say, but we don't want to be served by robots from the kitchen, for instance. Thank you.
Sorry, I'm not quite understanding. Are you asking if there should be AI solutions for patients? I couldn't hear exactly what you said, so just repeat that, please.
Because AI in medicine is going to be enhancing in terms of healthcare delivery between the patient and the healthcare worker, all right? So it can be across different technologies that will be utilized, but I'm just asking to say that we're talking about digitization, and we also saw that there is portals that patients or people can use them, and you need to have people who are society that is digitally literate. So I'm just taking to say, as being experts in the AI space, you probably know much better than I do in terms of the ecosystem of what is there. And do you think that we need to have public AI literacy? That's the first question. And then the second one is that, do you think we might have a pushback from the public in terms of, to say we don't want to be, we don't want to be we can't allow you, the doctor, to be utilizing this technology to assess me, for instance, because it's a new thing to them.
Okay, I now understand what you mean. So I think there's two parts to this. One, I think there will be a need for public AI literacy across anything you do. If you think about the next workforce, if you think about kids going to school right now, they are learning how to use AI to do all sorts of things where we didn't have that privilege. By the time they enter the workforce, everything will be AI. Everything that they do, and it doesn't matter if it's writing an email, if it's writing script or code, I do think there is a need for anyone to publicly upskill as much as you can on AI. And I'm not saying go and learn about advanced machine learning. What I'm saying is use it in your daily lives. And again, use it with caution. ChatGPT is not there to put public libraries on, guys. But I think it is important. I think there is a need for people to understand what AI can do, what it can mean, and how to use it responsibly for anyone, not just within healthcare. And the second part of your question is, can the public push back? I think it's always very important to ask your patients, one, if they want to use AI. So when it comes to responsible AI, you always want to put a disclaimer. It's exactly like you'll see on ChatGPT, on Grok, on anything that you use. It will say that please take this information, please double check it, and it has to be the same with the information that we share. So although the information, for example, in the Netcare one is masked, it is completely anonymized, it is by ID number, when you log into the Netcare portal, you will see that there is a disclaimer that asks, do you want to allow your SOC, which is your summary of care, to be provided in an AI summary. So it is still your choice, and I think that's very important. You can never be forced to use it. And again, a doctor or no one can ever force you. I think at the end of the day, and I do want to use this example, during the COVID period, and Lucian mentioned how overworked doctors were, and I think how many people in the hospitals that were really struggling, and families sitting at home not being able to talk and to understand. So I lost my father-in-law during COVID, and it was really a hard time because when we lost him, we didn't really know what happened to him. We knew he went on a ventilator, and then he died. And that is the story of most people. Doctors were overworked. No one could understand that disease, and I tried to think back, if we had then what we had now, how much better it would have been, how much easier it would have been to understand in layman's terms what happened to him, instead of getting an ICD-10 code that says, he had renal failure. So I think, again, that's really where it comes to play, is that type of impact. But again, it still has to allow you as a patient to say yes or no. Does that answer it?
I'm going to focus on the second part of your question, and I can just say that the evidence is out, and it is a resounding yes, that the population and patients want this. And in fact, in some cases, they prefer it. I work in STDs and sexual health. The ability, the privacy, the confidentiality that a large language model affords them, that the stigmatized kind of healthcare system doesn't, has been very clear. They are feeling more comfortable to ask some radical questions. You should see the transcripts, it's very interesting. But they really feel that the large language model is more empathetic and patient than the human. So I want that to sink in for a minute, and for us to recognize how we are underutilizing these capabilities, if that's what healthcare, if that's what patients are experiencing. So again, my maybe punt is to say, come and talk to those of us who have some experience in operationalizing and making AI practical in these scenarios, because I do think that we want this to come to fruition, and we are kind of doing our patients a disservice by not making these available to them.
And another area where it's already been used quite extensively, right? And again, I think if we come back to the notion that great technology is invisible to the user. You want to have that patient experience, have that empathetic, caring kind of care, but not be exposed to all of the underlying technology that's driving it, right? So if we think about something like AlphaFold, which was the protein folding thing from 4 years ago, right? It basically mapped 200 million animal proteins in a year. And over the past 60 years, preceding that, without AI, we got to about 15,000. So what this has meant is that since AlphaFold has made that landmark discovery, we can now have a universal snakebite vaccine that doesn't have to be grown in horses. We talk about hyper-personalized medication. You can use that because you can use the patient's own proteins to create, we already have artificial organs, but reduce the risk of organ rejection and things like that, right? So the patient doesn't really care. As long as he's getting his new kidney and it's going to be fine, right? The fact that you use AI on the back end to kind of do whatever magic you did, he's like, just do what you do, just fix me now. So I think as long as we get to that point where it's invisible and it's just the value add is just so much greater than any possible kind of concerns you might have, or the concerns that we minimize to the point that they are kind of like negligible, right? We all know every time we get in our car, there's no chance you might survive every single trip, right? But we don't care about it because the risk is minimal. So how do we get that in healthcare as well, right? So make it invisible for the patient. If they have a great experience, I don't think they're going to care really too much about it.
Thank you for those insights, good panel members. I'm going to conclude by considering something quite important here, and that has to do with the progress of technology and the realization that once upon a time there was resistance to the adoption of cellular phones. How many of us don't have cellular phones? One variable. A second variable, that which makes us feel good, feel accepted, we have an emotive connection with, is something we will adopt quicker. AI is an interesting commodity because it bridges both on the basis of rapid evolution as well as having a human condition emotive connection. One of our panel members mentioned right now that the empathy showed by an AI tool is dramatically different, and humans obviously, we're not the perfect machines. We have ups and downs, it makes sense. And yet on the AI basis you have validation, you might have connection, and there's a real emotive perception of care. I'm saying perception because we have to wait for the singularity, but that's a different summit in entirety. Good people, thank you for your attention. I trust that this was insightful. Good panel members, thank you for your pearls of wisdom. It was great.